Hi, all. Thanks so much for watching Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and we are talking about our interview with Dr. Nick Patel, who is the Chief Digital Officer and Vice Chair for Medicine and Primary Care at Prisma Health. This was such a cool interview because as the Chief Digital Officer, you would expect that he's focused very much on technologies, and he is interested in focus on those innovations, but he spends so much time talking about collaboration and why it's so important to keep the patient at the center. And so much of it was driven by his personal experience, both coming here as a new person to the United States. And he said his family didn't fully understand the United States healthcare system. He was in a rural area that was 32 miles away from the closest doctor, and he needed to go pretty often because he had ear infections. And then he went into medicine himself and then had a son who was in the NICU for weeks. And so he was really concerned with the equity and is always mindful of that. And I thought that was really cool because I feel like so many people are either really focused on the digital end of things and not necessarily keeping the patient at heart. And then other people are super interested in the equity, but not necessarily thinking of these innovations that could really drive a difference. So for him to be able to merge both of those and see how you can leverage the innovation for the good of the patient and include the patient in the conversation was something that I really loved. I loved his approach. Apoorv, what were your takeaways?
Amazing journey that he's been on. I think you captured so many nice elements of it. It's very personal. It started at a really young age, and it's all about the community. I mean, he grew up in that same community where he went and trained, and then he had his own experiences as a father and his son in the NICU, as you mentioned, and now he's practicing and he's a leader trying to build that community up. What I particularly love is the boldness of his vision. I think that we hear a lot about collaboration, Stephanie. You know, you and I talk about it, and we talk about it a lot with our guests. But ultimately, what he's saying is that the healthcare that the state of South Carolina, for example, needs is not going to be delivered through one health system. It's got to be multiple health systems coming together, working together, trying to figure out how to meet the needs of the community together. And that's unique. You'd say, well, that's, okay, pretty straightforward. I guess that should make sense. But we have to remember that these are individual entities. They have their own brands. They have their own strategies. They're competitive. They need to be able to figure out how to bring in more patients, sometimes at the expense of each other. And now what we're saying is, yes, but they also need to figure out how to work together. And I find that to be actually very inspiring because maybe it's possible that competitors could find a way to become collaborators in some setting. So I wish Dr. Patel all the best in his endeavor. And who knows, Stephanie, as you and I were just discussing before this recap, maybe there's a role for speaking of making healthcare work for you in that collaboration as well.
Absolutely. Be sure to check out the interview if you haven't already, and we'll talk to you all soon. Bye-bye.